What is intraocular lens or IOL? Intraocular lens is an artificial lens that is inserted in the eye after removal of the cataract. This is being done from 1949 and it has been implanted in millions of people. This is one of the best inventions that have happened in the field of ophthalmology. Before IOLs, when we remove the cataract, we were giving people thick spectacle lenses, and without these lenses or spectacles, whole vision used to be blurred. Now people with intraocular lenses enjoy excellent vision and their spectacle power post-operatively will be very minimal, if at all any.
Intraocular lens implants, commonly called IOLs, may be one of the most important ophthalmic developments in the last 30 years. These tiny prescription lenses are permanently placed inside the eye to restore focusing power when an eye's natural lens has been removed as part of cataract surgery or lens replacement surgery. Before the development of IOLs, the only way to restore focusing power in an eye after cataract surgery was with thick Coke bottle glasses or contact lenses. Without those glasses or contact lenses, a patient could see only shapes and colors. Today, those thick glasses and contact lenses are eliminated with an IOL.
While choosing a surgical package, be sure of what kind of functional intraocular lens you are going for, whether it's a monofocal or a multifocal or an accommodative lens. Know the details about these lenses and choose what is best for you.
If you require cataract removal surgery, choosing the right lens implant is an important decision for you and your doctor. The lens implant's selection is the basis for optimum vision enhancement post-surgery and for lifestyle improvement. In the past, patients had limited lens implant options to meet their visual needs. Today's lens technologies now offer optimum natural vision with premium lenses. The two main premium lenses are multifocal and accommodating. Multifocal lenses focus light from different distances on the retina simultaneously. Accommodating lenses mimic the movement of the eye's natural lens, which allows the eye to switch focus between different distances. In order to determine which lens is right for you, consider your lifestyle and ask yourself, do you focus more on near or on far objects? How important is color and contrast sensitivity to you? How often do you drive in nights? It is also important to discuss your goals following the procedure to ensure your expectations are realistic. Keep in mind that your vision will continue to change over time and may require additional care in the future. After considering all these factors, your doctor will recommend the lens implant or perhaps a combination of lenses that should provide you with the visual freedom you desire following cataract surgery. The eye's natural cataract clouded lens removed and replaced with a clear artificial lens implant should certainly improve your vision. However, the conventional artificial lens provides a single fixed focus. It cannot give far distance focus one moment and near focus the next, like the eye's natural lens does in a young person. Thus, after cataract surgery, eyeglasses are still needed in order to shift the focus of your eye from far away to close up. While we're young, the focusing muscles inside our eye can change and control the shape of our natural lens. This change in lens shape allows us to shift our focus from far away to close up, and this natural focusing ability is called accommodation. Unfortunately, the eye's natural lens hardens as we age, and as it loses flexibility, we lose our accommodation. The term used to describe this natural and unavoidable loss of far to near focusing ability is called presbyopia. By our 40s, our diminishing ability to focus up close must be replaced with reading glasses, bifocals or trifocals. Conventional artificial lens implants do not correct presbyopia because they cannot replace the need for reading glasses either. Aspheric lens implants are now available, which can improve the quality of vision following cataract or lens replacement surgery. These lens implants are specially designed to reduce visual disturbances such as glare, which are commonly found with traditional lens implants. Traditional lens implants were spherical, meaning the front surface is uniformly curved. Aspheric lens implants are slightly flatter in the periphery and are designed to provide sharp image quality and improve contrast sensitivity in low light environments. Patients who wish to have the best quality of distance vision, especially in dim or dusky conditions, may wish to consider an aspheric lens implant, but need to remember that it will still be necessary to wear reading glasses or bifocals to correct their intermediate and near vision. If you're particularly demanding and want the best possible distance vision after cataract surgery, you should discuss this option with your eye care professional during your cataract consultation. A special type of lens implant called a multifocal simultaneously provides both near and far focus and can greatly reduce your dependence on reading glasses after cataract surgery. This is because part of the lens focuses in the distance and part of the lens focuses up close, and indeed the name multifocal means multiple focal points. The design is entirely different from bifocal eyeglasses, where you look for the top portion to see far away and the bottom area to see up close. The multifocal lens implant is engineered in a way to provide both the distance focus and near focus at all times, and the brain naturally and automatically finds the correct focus. Conventional lens implants are called monofocal lenses because they cannot provide the ability to see both far away and close up without glasses. Both the conventional and multifocal lens implants are implanted through tiny incisions and are equally safe, and there are no differences in the surgery itself. Not everyone with a multifocal lens implant can read equally well without glasses, and there are several reasons for this individual variability. For example, the healthier the retina is and the less astigmatism one has, the better the reading ability will be. It is also easier to read without glasses if both eyes have multifocal lenses, although it can be placed in only one eye. While there is no guarantee that you will read as well without glasses as you desire, it should be much better with multifocal lenses than with conventional monofocal lens implants. The multifocal lens implant probably won't totally eliminate eyeglasses because most people will still find it easier to read with glasses under certain conditions such as prolonged reading, reading small print, or reading when the lighting is poor. However, multifocal lenses should provide the convenience of reading many things without having to put on glasses such as wristwatches, cell phone, price tags, menus, and magazines. This avoids the inconvenience of always having to wear reading glasses to view anything up close. Remember that when you do wear reading glasses, you should see equally well with a multifocal or a conventional lens implant. Although multifocal lens implants reduce your dependence on eyeglasses, there were some trade-offs besides the additional expense. The lens can create the appearance of halos or rings around lights at night. Fortunately, seeing halos is a distraction that doesn't obscure the focus, and most patients describe them as being minor. Halos won't be appearing during the daytime and become much less noticeable over time as your brain gradually adapts to them. This is similar to the way in which your brain blocks out background traffic noise over time. A multifocal lens implant isn't right for everyone, and it won't work well if you have too much astigmatism or other problems involving the cornea, the retina, or the optic nerve. Remember that both multifocal and conventional monofocal artificial lenses will provide excellent vision with glasses following cataract surgery. The difference is in what you can see when you aren't wearing eyeglasses. When we remove a cataract, we replace it with artificial lens. Many patients ask us when we perform surgery if we can help eliminate the need for glasses, and typically we can do that. Our first priority is usually to give you good distance vision. Some patients are also interested in seeing well up close after surgery without glasses. To achieve that, we have to use special premium implant lenses that can focus distance and near. One very effective way to achieve good distance and near vision is to use two different styles of premium implant lenses. Frequently, an accommodating lens is placed in the dominant eye. Accommodating lenses have a unique ability to shift their focus from distance to near. But accommodating lenses sometimes have difficulty focusing very close, and that's why in the non-dominant eye, we will use a multifocal implant lens which sees extremely well here. The effect is that you have two eyes set for distance and you have two eyes set for near, but the near sense are intentionally offset so that at the extreme near, one eye predominates and at intermediate range, the other eye predominates. Combining the two types of lenses gives the best of both worlds and typically allows good vision at distance, intermediate and near. Most patients tell after surgery that their eyes function in a completely natural feeling fashion. It's important to know that no matter how carefully your surgeon measures you, some patients do not achieve the planned target after surgery. All artificial lenses have the ability to produce subtle changes in your night vision, especially in the first few months after surgery. Typically, patients report that their night vision is actually significantly improved compared to the way it was with the cataract. But in the early post-operative period, some patients will report rings around lights at the night, streaks, or other phenomena. All insurance companies and Medicare feel these premium implant lenses are optional devices and therefore they're not covered by insurance. And while your insurance coverage might take care of vast majority or perhaps even all your cost in cataract surgery, use of these premium lenses unfortunately is not covered. Unlike conventional fixed focus artificial lenses, accommodating lens implants give you some ability to naturally change and adjust your focus, thereby reducing your dependence on eyeglasses. Recall that accommodation is the natural ability of a young eye to shift focus by changing the lens shape. If the lens implant could also change in shape or position, some focusing ability could be restored. An accommodating lens implant is specially designed so that your eye's naturally focusing muscles can slightly move it and flex it. By restoring some ability to change focus, patients who have good distance vision will typically see better without glasses in mid-range distances with the accommodating lens compared to a conventional fixed focus lens implant. For example, if you can see well enough to drive with the accommodating lens, you should be able to focus into the dashboard also. The latter is a good example of our need to see many things in the mid-range or intermediate distance that is neither far off and the distance nor up close. Other mid-range tasks include playing the piano, working on the desktop computer, cooking or viewing items on the shelf with arm's length. No current technology can totally eliminate eyeglasses. In other words, the accommodating lens does not restore the complete focusing ability that we all enjoyed when we were young, and low-power reading glasses are still typically needed for reading up close. However, the accommodating lens should allow you to focus across the greater range of different viewing distances without glasses compared to a conventional single focus lens implant. As you might imagine, individuals vary in how well their eye muscles could focus in accommodating lens. In addition, your retina must be completely healthy to achieve the optimum results, and the print size and the amount of available light will also make a difference.